All right, so it is so important for us now to move on to our next speaker and for me to introduce to you Dr. Bonakdar. Dr. Bonakdar is the Director of Pain Management at the Scripps Center for Integrative Medicine. It's a position that he has held since 2002. He also serves on the Scripps System-Wide Opioid Stewardship Committee. Dr. Bonakdar is also serving as a course director for the Susan Samueli Integrative Health Institute's new Integrative and Functional Medicine Fellowship, and he is spearheading the upcoming Nutrition and Supplementation in Clinical Care Conference hosted by the Institute. Dr. Bonakdar is certified in headache management by the United Council of Neurologic Subspecialties and board certified in integrative medicine by the American Board of Integrative Medicine. He is an editor of the Oxford University Press textbook, Integrative Pain Management. He also founded and serves as course director of the Scripps Continuing Medical Education Conference Natural Supplements and Evidence-Based Update. So here today to help us age gratefully, please join me in welcoming Dr. Bonakdar.
For the second year in a row. Last year we talked about migraines. Today we're talking about aging gratefully, which as the years and gray hairs, as you can tell from my picture, which was, I think when I was in junior high, needs to be updated, are becoming more present. It's a topic that I've been very interested in. And I think we need to transform how we age, and there's many reasons for that. So we're going to talk about how to transform and some of the practical steps to be able to do that. So to transform, we need to do a few important things. Number one, we need to really question our models of aging. And I'm so glad Dr. Malik talked about some of the leading research looking at how we can reverse aspects of genetic aging, and I'm going to talk about reversing some aspects of muscular aging, et cetera. We need to really question those models and assumptions. We also, I think, need to really look at what's a better model, things like aging gratefully. And I'm going to also introduce the concept of the 3 M's, muscle, mood, and memory, and how they're interconnected. And finally, I'm going to hopefully give you some practical tools you can take home today to be able to begin the process of aging gratefully. So let's question our models of healthy aging as a starting point. So what is our model of aging? It's usually one of linear decline. And what I mean by that is we see each other as a sports car when we're young, right? Someone like that. But we almost begin to use language like a car breaking down. We might say things like, his joints have wear and tear, or she's running out of gas, or he's a bit rusty. To the point where we see yourself going towards an old jalopy headed for the pound. Another problematic model is that of kind of passive aging, aging gracefully. I never liked that term, especially as I'm going towards more birthdays. And I think this comes up with the concept of like, we're just getting ready to go off into the sunset. And I think absolutely this is the time as we're reaching the second half of our lives, as Dr. Malik said, to really be able to look at new models. So what's a better model? And I think this comes from a lot of research that I'm going to point out later. But aging gratefully has the concept that this is really a time of gratitude and strength. It doesn't have to be something we fear or fight, as well as creating a new model of growth and renewal. So instead of a broken down car, how about a forest where there's always new growth as well as great reverence for the trees that have been there the longest? And I think that's a better model. Forest, better than the car. And so why does that matter both mentally and physically? So I'm going to give you some examples mentally. So this is the first of three women researchers that I'm going to point out. The work of Becca Levy at Yale asks simply, does the messaging we use as we're aging affect our actual aging? Now, we always use those terms like getting rusty or running out of gas, but she took 2 actual groups of older Americans, and she basically said, what if we use negative terms like old, frail, dependent, slow, and retested them and found that it actually affected their memory in real time right after those comments. She then took another half of the group and had positive comments, such as accomplished, wise, balanced, and capable. and found that those comments immediately had benefits in memory, walking speed, as well as blood pressure and other positive benefits. She also followed groups over time and found positive messaging. Actually, that group had an additional 7.5 years of healthy aging versus the group that used more negative comments. So the first point is how we think about aging actually makes a difference on its own. So that's where we need to start. So what about physical renewal? So I'm going to share a story not too many people know. A few years ago, I was seeing my eye doctor for my annual screen, and I thought I was doing pretty well, trying to take care of everything. And he said, "Rob, you got aneurysms in the back of your eye." Now, you don't want any doctor ever tell you you have aneurysms, especially when you got to go back to clinic and take care of patients. And I said, "What happened?" And he said, "It's probably from diabetic retinopathy." Now, both of my parents are diabetic. Both have passed, but they were both insulin dependent. And so it was in my trajectory. But I could take the path of the broken down car, look at that, and say, this is not going to get any better. It's probably going to get worse, and I'm headed for the junk pile. Or I could look at the renewal model and say, what can I do? And it really starts with trying to do all the things we can. I'm glad to say just within the last few months, my more updated scans showed no sign of retinopathy, which has been a progressive improvement over the last few years. And that is an aspect of looking at what model we're going to follow, making that choice, having a lot of proactive lifestyle measures that we can take, and being really good with assessment, early assessment, which in my case, a lot of the blood tests didn't show much, but eye scans did. So be really active with those yearly scans. And there's another scan that is actually available here on the lower right. It's the Eye Promise, which I think is really innovative because, and I use this in my clinic to look at the retinoid carotenoids, the healthy products which are our natural blue blockers. And in many cases, Americans, because of our screen time and because of our nutrition, that tends to be low. So detecting that very early is something that is not only helpful to our eyes, but the research shows that if we are able, with our diet and exercise and supplementation, to improve our carotenoid, along with omega-3s, as we'll talk about more, it not only helps our vision, it also helps our ability to drive longer and better. It also helps our memory, our verbal fluency. So taking care of your eyes is one example of physical renewal. But what is that example for you? You can start anywhere on this model that the center has created, but I would say a good place to start is muscles and exercise, because muscles are really the most vital organ of aging. And I'm going to try to explain what that means. The trend, and that's a key word, trend, it's not going to happen in every case, but in some cases, as we age, past the age of 30, there's about a 3 to 8% decline in muscle mass. When we reach about 50 or 60, that doubles, so it's about a 15% decrease per decade. At the point that we are 80, that can actually be a 50% reduction in muscle, which is a term known as sarcopenia. That's the medical term for that disease. And this tends to be much worse in women than men for a number of reasons, hormones, et cetera. One of the key things that we know, and this is the second concept that I think if you go home with one thing, is the interconnection of these 3 M's. When muscle goes down, i.e. sarcopenia sets in, it also affects mood and memory. Why? Because the muscle is not just a muscle, it's actually an endocrine organ that releases a number of key chemicals such as brain-derived neurotrophic factor and a number of other key elements that go on to support memory and mood. And when we don't have that, we have problems. So we need to overcome some of the assumptions to be able to keep and build muscle. So what are some of those assumptions that we're going to hopefully overcome? So one of the key things as we look at muscle aging is we look at muscles of middle-aged folks in their 40s, and then if we look at muscles of those sedentary folks in their 70s, it doesn't look good. The fat takes over, the muscle kind of gets shriveled up. No one wants that. The issue was, is this always the case? These researchers took the same athletes and followed them for the next 30 years, and they said, if you continue to be active, your muscles show almost no discernible difference with those 3 decades younger than you. So these are actually 70-year-old muscles on the right. And what they found was that our assumptions about muscle loss are based on not good science, that basically it's more about disuse than it is about our age. So that's the first assumption. The second assumption is, I don't have time to go to the gym and lift weights. These researchers did a great article, which is basically called No Time to Lift, ? They basically took 3 10 to 13-minute exercise sessions per week. 3 13-minute exercise sessions per week, much less than the current guidelines, which are at least 30 minutes, 3 to 5 times a week, plus 2 other times for weight training. And that had the same benefit, if it's well planned, as much longer bouts. So time is not an issue. The other assumption is you have to hit the gym. While the gym is important for some aspects, mindful exercise is incredibly important. This is me teaching a class which I like to do, especially for healthcare providers, teaching Tai Chi. Because mindful exercise like Tai Chi and yoga has incredible ability to help with balance, lower body strength, as well as helping with mind-body balance, reducing stress, blood pressure, etc. So keep that balance of mindful exercise with resistance exercise. Probably the most innovative research that I'm going to share with you is this, which basically goes after the assumption of, oh, it's too late. I'm already a couch potato. I'm already going for the junk heap. Yeah. And they said, wait a minute. We're going to take 100 participants, average age of 87. Oldest one was 98. And we're going to put them through a 10-week weight training class. And what they found is 95% finished. It was safe and well supported. People liked it. And when they finished, there was over 100% increase in muscle strength, as well as improvements in walking speed and overall agility. They asked the second question, what if we add a protein supplement? What they found was basically that if they added with resistance, it helped. But if they added by itself, sort of as a magic bullet, it didn't help. That's the red dot there. So speaking of protein, I also want to keep in mind that the assumption is that we all need the same at any point in life, male or female. That's absolutely not true, in my opinion. The guidelines now say 0.8 grams per kilogram. What that point basically says is based on your weight, you need a certain amount. More recent research shows that if you are actually trying to keep your muscle, and as we're aging, when we know absorption of proteins changes as well as increased need, you basically need twice that. So what we thought was the guidelines probably needs to be increased to double that. And when you look at that number, that may seem like a lot. And how do you do that? Well, I think one of the ways we need to transform our intake is a more balance throughout the day. So it's not dinner heavy with high amounts, because we can't really absorb more than 30 or 40 grams. And in addition to that, the other key tip here is some type of nighttime snack, not right at bedtime, but a few hours after dinner. A protein snack can be really helpful, because research shows that one of the most important times where the body's not multitasking is actually when we're sleeping. And that's a time where we can actually make increased muscle while we sleep. So 2 other key supplements I'm going to point out. Creatine very quickly. We think of this as a bodybuilding supplement, but really it's a supplement that in low dose helps us build muscle and bone, which tends to be a factor that's much more important in women. When you're looking for supplements like this, look for the NSF seal as one example. This is actually a supplement regulation which allows supplements to be used by even Olympic athletes to make sure there's no adulterants. So look for that when you're looking at any supplement. The second big supplement that I use in healthy aging, there's many, but this one has a big ability, omega-3s, to prevent cognitive decline onset. So if we're low, like many women over the age of 50, it's important to supplement especially. Studies have shown that about 2 grams per day, in addition to resistance exercise, not only helps with cognitive decline, it also helps with muscle strength, muscle performance. So those are some key things. And as was mentioned earlier, we are going to be launching this program, which I'm very proud to be the director of, which is going to be in January. There's cards in your bag. It's very preliminary. We're still getting all the great speakers together, but keep that in mind and hopefully on your calendar. So 2 other things that I want to point out that support exercise are sleep as well as our environment. So why is that important to talk about sleep? Because we know as we age, sleep becomes more difficult. That's the trend, just like muscle loss, but it doesn't have to be. We know that one of the most important things is actually exercise. If we are able to regularly exercise, it improves our ability to get to sleep, stay asleep, and have higher quality deep sleep. So that in and of itself also has the benefit of sleep. We also know that the assumption that if we age, we're just going to continue, and we have problems sleeping, it's going to continue forever. That's absolutely not true. We know that if we really focus on sleep hygiene, decreasing screen time, improving our bedtime routine, not trying to balance our checkbook 10 minutes before we go to bed, or try to binge Netflix, not that anyone here does that, that can help, as well as journaling. In 4 sessions, We also know mindfulness meditation, one of the practices taught at the Institute, can be incredibly helpful within a few sessions to hit deeper sleep, something that I start with my patient. The last thing I want to talk about is environment, both external and internal. So our external environment, unfortunately, ends up being inside of some type of building, typically in our TV room, 92 to 97% of the time, which is not how our bodies are made. And in many ways, it's about doing our best to be outside more. I'd like to introduce a second researcher here, which is Dr. Rachel Hopman, and she came up with the 25 and 3 rule for time in nature. How many people have heard of this rule? Maybe a few. So this is a really important rule because it says that we need to spend at least 20 minutes 3 times a week, which is the minimum to reduce cortisol levels. That's the minimum. More is better in a park. She also found that if you take your phone there and try to do an Instagram post, there's no benefit at all. 0. And that was actually proven in a research. I'm not just saying that. I'm not just saying that because your kids might try to do that. The next rule is 5 hours a month in a semi-wilderness like a national park and 3 days a year off the grid. It's an incredible, powerful medicine that's hard to describe, but she has done the research. This is me just a few weeks ago. I'm in the back of that pack of four folks there, about 7,500 feet. Just, again, getting that powerful medicine that I think is so important. The last part of this is our internal environment, which is basically what we started with, gratitude, gratefulness. And there's actually programs out there. This is the Grateful Aging Program, and this is the researcher Marilyn Schlitz, the third amazing female researcher, which is looking at how do we transition how we think about aging to something that we are grateful for, something we can share and really become mentors, become that tree that everyone reveres, as opposed to someone who's scared going into the second half. And this program is great. We're actually looking at creating an online course, spoken with Dr. Malik about how do we incorporate some of these pearls in a way that we can advocate for ourselves as we go into the second half and really be ahead of the curve. So with that, I want to leave you with 2 summary points. Number 1, it's really important to look at aging in a way that is just as much about what we do with our non-doing, our rest, our meditation, and our sleep. Optimizing that is really important, as well as the setting where we do it. Hopefully outside with people we love and enjoy being with, as well as the mindset. That's probably the most important, as the first research I mentioned showed. It's about really being able to be grateful for every moment that we have and make the most of it, as much as it is about what we do. And still it's important to get good exercise, still it's important to get resistance, but all those assumptions I made, hopefully got rid of, makes it very capable to do it with just a few minutes per week. And I think that's what's helped a lot of my patients, to see this not something as difficult to overcome, but something that's very doable. So with that, I want to end with the 3 M's. And we talked about when any of those 3 M's start knocking each other out, it makes the whole 3M into a vicious cycle. And that's sarcopenia, which is a very difficult word that hopefully we can get lower and lower in the American population, can actually be reversed. And when we improve muscle or maintain muscle, it actually improves the other 2 M's, the memory and the mood. And the research is very clear on that. So the good news is, wherever you are, if you help 1 M, you're going to help the other 2, and it's going to be a very positive cycle. So with that, I want to just ask you to take a moment and look at where aging is and how you think about it, and hopefully you have a few tools to transition from aging gracefully to aging gratefully. Thank you so much for your attention.